long-term study of retinopathy of prematurity seque at a single center in North India.
Good afternoon, everyone. My topic for the day is ROP over the decades. So we did a long-term follow-up study of retinopathy of prematurity patients at a single center in North India. The aim of our study was to study the sequelae after ROP regression with long-term follow-up and analysis. It was a retrospective and observational study which had 65 patients who were diagnosed and treated at the single center and the time period ranging from 2003 till January 2025.
Kindly stop. I'm not able to see the whole slide. Previous slide. Next slide. Yeah, now it's fine. Kindly reset the timer, please. Reset the timer to 5 minutes.
So the best corrected visual acuity, refractive error with cycloplegic retinoscopy and fundus examination was noted at every follow-up visit, and the stage and severity of ROP was classified according to the ICROP, that is the International Classification of ROP guidelines. The exclusion criteria of the study being the follow-up for less than 1 year, or the patient had stage 4 or stage 5 where there was urgent need of surgery and the patient was referred accordingly. So our results showed that out of the total, there were 35% with type 1 requiring urgent treatment and type 2 ROP in about 64% patients, which were observed subsequently till the disease was regressed and then later on. So out of those who needed treatment, the 23 that needed treatment, 2 got anti-VEGF injections, 19 underwent PRP laser and 2 was cryo. So this cryo was back in 2003-2004. The rest 42 patients had spontaneous regression. The median follow-up was for 3 years, the range being 1 to 20 years. So on analysis, the most common outcome was refractive error, followed by amblyopia, strabismus and nystagmus in one patient. So we also studied the correlation between the best corrected visual acuity and the birth weight, BCVA and the gestation age, BCVA and the comparison with the stage of ROP at the time of treatment, and the comparison of best corrected visual acuity in eyes those received treatment versus those that underwent spontaneous regression. Since there were only 2 who underwent anti-VEGF, so this data was excluded from the statistical analysis as the number was very small. So on correlation with birth weight and BCVA, as the previous studies have proved, the lower birth weight is associated with a poor visual outcome, which was less than 6/18 in our study, and the gestation age, so the higher the gestation age, the better the ultimate BCVA outcome. And correlation of the stage of ROP and the BCVA, so the severity of ROP has a negative correlation with the long-term BCVA. Initial stage is not a very good predictor because of the variability in the outcome. Stage and zone of ROP in patients have a significant effect on myopic progression as well, especially with severe disease resulting in a very fast myopic progression. That is high myopia and a very short duration, so the initially 1 to 2 years of life. Now comparison of BCVA at last visit in eyes post ROP treatment versus those with spontaneous regression. So 73% of eyes had achieved 6/12 or better vision. 27% has vision less than 6/18 or worse in laser treated patients. So multiple linear regression analysis revealed that better visual acuity significantly correlated with less severe myopia. Significant myopia was observed in those who had treatment, and out of the laser treated, 70% had myopia, and anisometropia was seen in 17% only. There was no significant association seen as such for strabismus patients. So coming to our discussion, the refractive disorder, they are the key factors when talking about visual outcome in patients with regressed ROP. And long-term outcomes of a study is, it cannot be concluded that laser plays a causative role. However, as myopia is related to scleral weakening, other factors are also should be taken into account, including anomalies of the corneal diameter, the curvature, anterior chamber depth, lens power and axial length. Laser definitely causes disturbed ocular growth in infants, also due to the other systemic factors as well. Anisometropia also occurs in regressed IROP, mostly due to, as proved by theory, that asymmetry in the final peripheral retinal fibrosis can lead more significantly to anisometropia. So to conclude, refractive errors, they cause permanent visual impairment, even if cases having a stable retina status. So delaying in detection and adequate management of these refractive errors can eventually lead to amblyopia. The results of our study showed higher prevalence of refractive errors in ROP treated eyes, and prematurity along with physiological disruption caused by treatment modalities in the growing stage affects the final outcome. This is one of our patients who underwent cryo in 2003. On his last visit, this fundus photograph was taken. He has a BCVA of 6.9 in both eyes, but he has a very high refractive power. He has a high myope with -9. So the limitations of our study was that we had not taken into account the analysis of the retinal structure as being down with newer modalities like OCT. And also there was no comparison of axial lengths on subsequent visits. The patients who underwent surgery were excluded from the study. It is a small sample size of 65 patients, and detailed analysis of number of laser shots, the energy used was not done, and the control group of full-term babies was not there to compare. Thank you.
So, excellent study. Dr. Jasneet, now coming to the sequelae, so you are talking about the progressive myopia and strabismus. What about amblyopia? Because they are also commonly seen as a sequelae in these ROP patients. Regressed.
Sir, amblyopia was the second most common sequelae in our set of patients.
Did you
So the
mention
first
in any of?
Yes.
Okay.
I mentioned it in my slide. The 70% was refractive error, second was strabismus, and there was in the refractive error group. Subsequently, there were 24% who had amblyopia.
Dr. Bharat, any question?
So the PPT is closed, but it was in retrospective observational study. So the
यहाँ से press
So some kids had spontaneous resolution, some had laser. So did you actually wait for spontaneous resolution, or but because I don't understand which subset of kids have you chosen? Are you choosing
All were regressed ROP cases?
all the regressed ROP cases, and then we further studied the comparison between the two, that those who underwent laser and those who did not undergo laser, and the
So what was
comparison
the
of-
age? What was the age group of kids which you chose?
Sir, it was a follow-up study, so we followed them up.
No, so what was the age? Means range, there must be some range, no? This is what sir is asking.
See, if you are following up, it is not retrospective, it is prospective. If you are following them up, that
Sir,
means you are starting
it is
from
a
one point.
retrospective data. The data
That is
started
what
from
confused.
2003.
Yeah.
The study the data collection started from 2003, and we collected the data of the patients who followed up at the center up till
So
January.
that means it is not retrospective anymore. Na? From 2003 it became a prospective study.
You mean to say they were treated for ROP, right? And later on followed in their childhood. This is what you are trying to say?
Yes.
Yeah.
So what was the age group? This is what we are asking, no?
So the
Means
average
5 to 12, whatever, some range?
3 to 20.
3 to 20.
Actually 1 to 20, the median was 3. So
Okay.
less than 1 year
But,
follow-up we did not take into account. So
If you are
post 1
following
year.
up for 20 years, I don't think it should be retrospective. It is a prospective observational studies. It is prospective non-interventional based. Yeah. Thank you.
Thank you, sir.
Thank you.